Listen, you're in a privileged position to learn a thing or two. Keep your mouth shut and your eyes open.
Countries around the world are facing a baby bust as a result of the pandemic. Experts blame the birth rate drops on several factors: fear of bringing a child into the pandemic, a poor economy, job losses, and the simple fact that social distancing has prevented people from meeting and potentially having children together. Provisional data from 29 state health departments in the U.S. show birth rates falling about 7.3% in December 2020. That month marked 9 months after the coronavirus was declared a pandemic. Birth rates were already falling in the U.S. before COVID-19 hit. Philip Levine joins us now to dive into what this baby bust means. He's a professor of economics at Wellesley College and specializes in studying long-term impacts of pregnancy, childbirth, and child rearing. Some people predicted a baby boom would come out of the coronavirus pandemic. Tell us why that was completely wrong.
Yeah, it was interesting. At the start of the pandemic, there was, births were going to go crazy because people had nothing else to do. As soon as they heard that, Melissa Carney, who I wrote this paper with, we understood that was just not going to happen. There's so many things going on in the world right now that would lead to fewer births. The economy is in very tough shape. People are worried about their health, the health of their others, health of others. Social interactions are inhibited from what they otherwise would be. Schools are closed for lots of reasons. We sort of expect to see fewer births coming up in the near future, and actually right now.
What sort of long-term impacts will lower birth rates have on the economy?
So, in some sense, if you follow, this is a smaller birth cohort, and if you follow them through their lives, you can see that it's going to hit in very different places. So won't be very long before, school, elementary schools will have fewer students, and then colleges will get fewer applications. The workforce will have fewer workers. An economy with fewer workers has definite impacts on society. So, fewer workers means less economic activity. It means less funding for the Social Security system, which is based on taxes that people who are currently working pay in to fund the benefits of current retirees.
Philip, I actually had a baby in the middle of the pandemic, which was incredibly frightening.
Congratulations.
7 months pregnant when the pandemic hit, and so I can only think about his future and being born in this time. Babies born today will enter the workforce as Gen Xers are retiring. How will these generations impact each other?
Well, in some sense, like I said, in some ways it's a good thing. There could be less competition for, your son or daughter. And there's some advantages to that. There's also some disadvantages. Like I said, I think that, fewer workers, current workers support current retirees through our retirement system. And the fewer current workers there are, the harder it is going to be to pay those benefits. So, I think that your son or daughter could have a, considerably different experience, and that could have impacts on others.
Thank you. It's a boy. By the way, he's 10 months. What other problems can we expect to see around the world as a result of fewer babies being born?
What's interesting about it is that, it's not just now that we're seeing this reduction in fertility. It's been going on, in the United States for the past decade and in many other developed countries, for even longer than that. Other countries have been worried about this for a long time and have even, tried implementing policies to help reverse the trend, and really with not a whole lot of success. In some sense, the reduction in births that we observe in the United States over the last decade is small in comparison relative to what other countries face. We seem to be in some sense catching up.
Philip, are some countries more severely impacted by lower fertility rates than others?
Like I said, I think that European countries have, and Korea, some other countries have, really experienced rather dramatic declines. So, people consider replacement fertility at, if you have 2.1 births in your life, then you've replaced you and your partner. We're in the United States at about 1.7. Many other countries in the world are at levels like 1.3, 1.4. Much further ahead of us in terms of, declining fertility.
There is typically a rebound in births after recessions and pandemics. What makes the coronavirus pandemic different? And when can we expect fertility rates to jump up again?
So to be quite honest, I don't think we're going to expect fertility rates to jump back up again. I mean, they may return to the level they were at before, but the thought that they are going to, that the births that aren't happening now are just going to happen next year instead, and over the 2-year period, we get the same number of births. That just seems unlikely. So in the recession, for instance, the Great Recession a little over a decade ago, births fell for, roughly a 5-year period before rebounding, but the rebounding wasn't to above what they would have been otherwise. The rebounding was to the level that they would have been otherwise, which led to, sort of a several-year period in which those births just went away and really never happened. And since a significant economic contraction is part of the problem we are experiencing now, my guess is that's likely to happen again in the coming years.
I've actually done a few stories on women, not just delaying birth, but women in the middle of fertility treatments who had to have them paused because of the pandemic, women who were fearful to get a vaccine, so they're still delaying trying to get pregnant. Time is everything when you want to start a family, when you want to become pregnant, if you're a woman who's reaching an older age. Can you give some advice to women, to families thinking about starting a family, having a child, adopting a child? Is there anything you can say to help alleviate some of the fears and concerns going on right now?
I mean, stress is a big deal. So, people make decisions in many aspects of their life, including whether to have a child at a particular moment, based on the extent of stress in your life. Life is extremely stressful right now. So it's not really all that surprising that it's affecting people's behavior, including in terms of fertility. I wish I had a magic pill that would eliminate the stress and tell people to go ahead and do whatever you want. But, unfortunately, I really don't.
Philip Levine, thank you for your insight and for your time.
Thank you.
Listen, you're in a privileged position to learn a thing or two. Keep your mouth shut and your eyes open.